Hi everyone, this is Dr. Anderson. There's been a lot of press lately about some new standards that have been put in place by some of the big thyroid organizations, the American Association of Clinical Endocrinologists and the Thyroid Society. Now they're saying that you don't need to run proper testing. They're saying TSH is enough. Now I'm here to talk about thyroid fact and fiction to give you some basic information that you need to know about your thyroid and what tests need to be run if you want to get properly diagnosed. Now, I'm board certified in integrative medicine. I'm a chiropractic physician. I have years of experience in treating patients with thyroid dysfunction in my office. My private practice is in Summit, New Jersey, and I've got a good bit of information I want to share with you. Now, first and foremost, what do you actually know about thyroid diagnosis? Do you actually know what your thyroid does? You may have been told you have a thyroid problem, and if you're going to actually understand how the thyroid works, what tests should be done, you have to understand how you got here. So what we're going to do is we're going to talk about some basic thyroid physiology. It's really simple. It looks really difficult, but it's not, I promise you. So everything starts in the brain, something called the hypothalamus. It releases a hormone into your pituitary gland to make something that you've all heard of, which is TSH, thyroid-stimulating hormone. So once TSH is produced, the thyroid-stimulating hormone is going to tell the thyroid gland to make hormones. Now, TSH is one of the two tests they're saying you should run. The problem is, once a thyroid gland produces hormones, and it makes two hormones, T4 and T3, those hormones still have to do something. Now, here's the important thing. T4, 93% of what the body makes is T4. Only 7% is T3. So what that means is T4 is not the active form of the hormone. T3 is. So T4 is produced, but it can't be used. It has to be transported, and what happens is it takes a little taxi. It gets turned on. It gets converted from T4 to T3. Now, this is important because they don't want to test T3. They don't even want to test for T4. They only want to test TSH, and this is what they're telling you. So you have to know how much thyroid hormone the body is actually producing. Once T4 is produced, it converts to T3. 60% of that occurs in your liver, 20% in the gut, and 20% in the tissues. Now, if you don't know how much T4 is converted to T3, you may miss the cause of your problem completely. Now, I see a large percentage of patients who don't have a problem with TSH or with T4, but still feel horrible. It's because their body's not converting T3 because of issues in peripheral thyroid conversion, problems that are occurring elsewhere in the body. Now, there's certain tests that you have to run. When you talk about traditional common tests that you run, TSH is what you're talking about. The thyroid-stimulating hormones is what they say to run. T4, they may say to run as well, but that's where their standard ends. These are new guidelines as of 2013. Now, the problem is if you don't run a complete thyroid panel, you're going to miss the boat. You need to test the free thyroxine index, free T4, T3 uptake, free T3, free T4, reverse T3. Now, if you're on hormone replacement therapy or birth control, reverse T3 could show an abnormality. You have to know that because reverse T3 can block T3 receptors and create problems with your body using thyroid hormone. How about thyroid antibodies? In 1998, the Journal of Metabolic and Endocrine Disorders, the #1 thyroid journal in the world, said 90% of thyroid patients, hypothyroid patients, have an autoimmune cause. 90%. So if a patient comes in who has hypothyroidism and they're concerned about their health with me, you have to prove to me you're not autoimmune because likely you are. That's what science says. That's what research says. That's what clinical experience says. That's what your MDs will agree on, but they won't do anything if you have Hashimoto's. And how do you know if you have Hashimoto's? You test antibodies, TPO and TBG antibodies. Now, they may tell you you have Graves' disease. All they're going to do for Graves is put you on a beta blocker for your heart or cut your thyroid out. Maybe kill it with radioactive iodine. They're not going to treat the immune problem. So again, the key thing is they're not running the right tests. They aren't looking for where the problems are, and they're saying you don't have to. They're giving up on thyroid patients. So if you want to learn more about an alternative approach to managing it, my name's Dr. Brian Anderson. We're in the New York, New Jersey area. Visit us on Facebook. We're adding new information daily. The page is Premier Health of Summit. If you have a thyroid problem, don't accept what they're doing with the new standards. I hope you find what you're looking for. Please use me as a resource if you want. I want to to make sure I got this information out because I know how frustrating this can be. Thanks so much. Have a great day.